Hi, I'm Dr. Matt Allen. Today, we're going to talk a little bit about how to communicate with patients, how to help patients feel like a partner in the care that they're receiving, because ultimately it is their care and we want to work with patients, not on or to them. So how can we talk with patients, work with them, and ultimately help them in achieving their oral health goals? We'll work on some styles and strategies that will hopefully help you find some things that you can start doing in your practice tomorrow. Today, what we're going to end up spending some time talking about then is really how do we communicate with people in a way that engages them, allows us to hear from them, allows us to partner. We know that communication is a two-way street. It's not a monologue, it's a dialogue. And so what are things that we can do as part of our daily flows in an office that might enable some of these patient-centered communication styles, strategies to come forth and allow us to talk with people in a way that truly engages them as a partner in their care, because ultimately it is their care. So we're going to give you guys 3 different ways that we think we can do that. But to start, I think something that's always really helpful is to kind of think about where we're currently at on this scale. On a scale from 0 to 10, where 0 is not confident at all and 10 is super confident. We did this last time, I think. But on that scale, 0 to 10, 0 is not confident at all, 10 is super confident. How confident are you, personally, at talking with a patient about, hey, there's more than just brushing and flossing, right? We know that if we really want you to get behavior change, how confident do you feel in actually having that conversation with the patient, not just telling them, you need to brush your teeth, you need to floss your teeth, you need to use X product. Just think about that, because I think it's a good place for us to start to say, okay, if I'm starting at a 2, that's fine. What's it going to take to get me to a 3? What do I need to learn? What can I apply from our talk today? If I'm starting at an 8, great. What's it going to take to get me to a 9 or to a 10? What are 1 or 2 things that I can maybe try or do to help me move up a little bit on that scale? But if we don't know where we start, then often we don't know what the next step might be. So just kind of think about that in your brain, what that might look like for you currently. We'll come back at the end, kind of hear, okay, based on today, do you feel a little bit more confident? Maybe you feel less confident. That's okay too. But it really just kind of helps to bookend, to know where we're at so that we can get to where we want to go. Everyone have a number in their head that they feel like, this is where I'm currently at. Great. Okay, so then before we kind of dive into the 3 ways that I think are pretty kind of low-hanging fruit in terms of how we can do this with our offices, why might this even be important? Because we can talk about the what, but if we don't actually understand the why, then maybe we don't have as much motivation for the what. And so we're going to spend just a few minutes of talking about the idea of why patient education is not enough. And to do that, what I'll do is I'll give you guys a little bit of theory. So why might that be the case in terms of kind of some theoretical ideas out there that are becoming less theory and more studies are being published on this. And then we're going to actually talk about the evidence. So what does that currently look like in the evidence? And I'm going to give you guys some different studies that I talked about last time that I think are pretty fascinating that highlight why patient education is not enough. So in terms of theory, who here has seen this idea before, social determinants of health? Yes. If you were here in May, you got to see it when we talked about it last time. This is the idea that someone's health is more than just what happens in an office or one kind of siloed part of their life. Health is made up of a lot of different factors, and they all have some role to play in terms of making someone healthy or not. We can think of what some of those things might be. So for example, you could say, well, someone's genes are super important in terms of their health, right? Some people might have genetics that make them more likely to get cancer. Some people might have genetics that make them more likely to stay healthy. So genes come into play, and that's true. Genes in biology is about 10% of someone's overall health. So great, I'm not a geneticist. I'm not out there working on this. There's people doing interesting things, but that's not me. I can't control that in an office, one-on-one patient setting. What else comes into play? Well, certainly things like physical environment. If you grow up in Flint, Michigan, and you're drinking the water in Flint, Michigan, that's going to look different than if you're growing up drinking the water in, I live in the Rockies, and you always see the Coors commercials talking about the cold, runoff from the Rockies. I think our water is pretty good. That's going to be different, right, than if you grew up in Flint, Michigan, and we can't necessarily control that. So physical environment plays a role, about 10% in someone's health. What else? Well, we look at things like social and economic factors, and I think we all have this implicit understanding that that is true. If you have to take 4 buses, like a lot of my patients do, to be able to get to the dental office, and it takes 3 or 4 hours, and then there's, weather, and then this is happening, and whatever, right? Like, you just can't end up making it to the office. And so that plays a big role in whether or not you can get the type of healthcare you want, or that you even make an attempt to do it. So that's a big part. That's 40%. Some really innovative work is being done around this in terms of how we can help make people healthier in this. Again, I am super supportive of that, but as a clinician, I'm not necessarily in the space to make a lot of change in that 40%. So then we get to clinical care, 10%. This is the kind of care that happens when I am working with a patient. Not on a patient, not to a patient. We're working with a patient, right? It's a partnership. We want to do things with people, not on or to them. And so this 10% is really important, right? You can still get an A, if you fail this totally, right? Like if we did everything else perfectly, we would still get an A, 90%. But that's not the kind of people we are, right? Like, okay is not good enough, right? We want to do the best that we possibly can in this area, but it's still possible to get an A, even if we're kind of not doing great in this area, which is different for me, certainly as a clinician, certainly the kind of, when I think about my day, I'm like, man, that's the only thing that matters. So I think this is helpful in terms of contextualizing to say, wow, a lot of big things are out there, and this is really important, right? We want to do the best that we possibly can in that 10%. We want to make sure that what's happening in the office and that clinical care is as exceptional as possible. So what's that last big bucket? Health behaviors. 30% of a patient's health is what they choose to do or not. And again, we know this. We can prescribe them all the prescription toothpaste in the world because it's good for them. And if it sits in their drawer and they never use it, it doesn't matter how much we know, how much they know, right? They're not actually doing the thing that they want to do. This morning, I woke up. Got in a little bit late last night on my flight. I was like, I'm gonna go exercise. I'm gonna run. It's gonna be great. It's nice out. And 45 minutes later, I was still laying in my bed, having hit snooze for the 5th time, right? Like, we all know that there's something about knowing something, but then there's something about actually doing it, right? So just good information isn't necessarily always good enough. We actually have to help people change behaviors. And so our 3 strategies and styles that we'll talk today are really designed at getting at that behavior change piece, not just simply about educating people. So this is the social determinants of health. Again, this is a theory that has much more evidence behind it now than when it came out in the last 20 or so years, kind of 30 or so years. And so we're really seeing this as, this is no longer theory, this is borne out in fact of, this is really what this looks like for people to become healthy. But I want to talk a little bit about specific evidence and specific studies just to kind of give you guys a little window into this world a little bit. So to do that, we've got some soda up here. And there's this fascinating study that came out last year in January in the American Journal of Health Promotion that looked at the knowledge of primarily Hispanic people regarding sugar-sweetened beverages. And what they found, they did a big kind of cross-sectional survey, and what they found was that it didn't matter if people knew or not that soda was bad for you in a lot of different ways. So dental caries, obesity, diabetes. It didn't really matter if people knew those things, it didn't change their behavior. So they could know, they could not know, people were still drinking about the same amount of soda. To me, that's fascinating. Right? Just knowing something, and inherently we all know that, right? Just because I knew it was good for me to get up this morning and go run, I didn't do it. But you see that in things that are definitely impacting dental caries. Just because we know doesn't mean we're actually going to do it. Another fascinating study, I think the paper is still in working form. They did a study to see, so who knows more than anything about health? Physicians, right? Like they should know the most. And so do physicians make better decisions when it comes to their health than people who don't know? No, they don't. For the most part. It's fascinating study that they do to go and look at, what happens to physicians? Do they have better outcomes when it comes to these Are they choosing good decisions for themselves or bad decisions? And they're really not that different from anybody else, which to me is just fascinating. It's not just knowing. It's how we take that knowledge and actually move it into action. And so let's spend a little bit of time then talking about taking that knowledge and moving it into action. But before one more thing before we get there, it's not just knowing, and it's not just actually, the idea of, okay, well, now that I do that, so how do I work on motivation? We have to think about the idea of engagement and what that looks like for people, because oftentimes what we want to do is we want to say, okay, well, what I'm going to do then is I'm going to have this good conversation. I'm going to introduce them to some new things. I'm going to help them learn about something new that they didn't know. And I'm going to do it in an engaging way. I'm going to be nice. Is that going to help them actually participate in the care? And what we see, again, from more studies is you can show that like when you give people information, their knowledge does increase, which is good. But that does not lead to a direct participation in their care. That does not lead to them engaging in their care. And engagement, as we'll see in just a minute, is so valuable in terms of that person taking an active role in doing the things that we might want them to do in their house. So what are the ways that we can really engage people? And the other kind of term for that is activation. What are ways that we can actually help activate them in terms of doing some of this work? So how does everyone feel right now? Feeling good? Feeling like, okay, these are some of the good reasons why we can talk more about why information isn't the only important piece. It's an important piece, but not the only important piece. Great. So one of the big questions that I get before we kind of dive into the three ways that we can do this is, what does this really look like in action? What does it really look like, sound like? This all sounds great, Matt. I'm tracking with you. I feel good about this. But what does it really look like and sound like when we actually do this? And so what we've done over the past several years is made videos to show people what this actually looks like and sounds like and how it might be a little bit different than what you might normally get to do. And so what I'm going to do is I'm going to show you one video right now that maybe kind of gives us just a quick high-level overview. It's about 3 or 4 minutes. Because one of the big concerns that we hear from people is that, oh man, this is just going to take so much time. There's just something else I have to do, something else I have to add to my current appointment. And that may be true at the beginning. Whenever we practice something new, there's that awkward phase where we're just kind of starting it, right? But what I tell people is, this is not something just extra to do. Like, don't do what you normally do and then add this on top. What we have to do is really reimagine what this can look like, and we have to kind of revision our conversations with our patients, what the flow might look like. And so to do that, I actually do think videos are helpful to kind of say, okay, cool, so that's, I can see myself having that conversation. So we'll show you guys one here that's a little bit longer, not super long, 3 or 4 minutes, like I said, that shows us maybe more of a full conversation. And then as we go through a couple of the specific parts, I'll show you a shorter video clip demonstrating a specific technique as well. Sound good? All right. All right, Craig, so we just took a look at your x-rays, took a look in your mouth. Love to kind of spend a few minutes reviewing what we saw and maybe just kind of talk about, what options we might have from there, okay?
Okay, sure.
Perfect. You've been coming here for a long time. You have immaculate oral hygiene. You always have. I am noticing something a little different this time, though. It seems like there's just, I don't know if you've noticed it, but it seems like there's more stuff kind of on your teeth, what we call plaque, or, some people call it buildup or whatever, but I'm just seeing more stuff on your teeth. And I was wondering, what might have gone on, or, has something happened in the last 6 months that's caused a change?
Yeah, that doesn't surprise me. I understand. I had an accident recently.
Okay.
And because of my hand now, I really have a hard time brushing.
Okay.
I actually even tried brushing left-handed. That didn't work. But it's been difficult. So
Okay.
I'm sure that's why.
Gotcha. So it's just even like hard for you to hold a toothbrush.
To hold the toothbrush and adequately brush like I used to.
Yeah, and you tried it left-handed.
Yeah, that was not good.
You're not a switch hitter for that.
No, I'm not.
You need your right hand is really your dominant hand. And
yeah.
Okay. Well, unfortunately, what that can tend to do is that can tend to put you at a higher risk for getting cavities. Right. And I know that in the past we've talked, you don't want that. You don't like coming in. You don't want to have shots. You're trying to avoid those things. So here we have essentially some things that people can do to help them avoid getting cavities. I wonder, when you look at this, are there things that you think, okay, well, maybe I'm not brushing my teeth quite like I want, but I wonder if there are things that you see that you're like, well, I could maybe do this or maybe do that.
Well, right away, one of the things that jumped out at me was maybe the possibility of adding a rinse. I wouldn't mind doing that because, again, I used to do a good job with brushing, and so maybe an extra step would be fine for me.
Okay.
That'll help.
Yeah, and it's not involving your hand then, so maybe a rinse might be
Yeah.
good for you. Yeah, I mean, certainly, you know, for patients like you, we've seen that rinses can be really helpful. We have one here that can be really effective. It tends to not only just kind of rinse things away, but it actually helps kind of control a lot of the bacteria in your mouth as well. And so if you want, that certainly could be something that I think could be beneficial in terms of, you know, helping you not get new cavities and have problems in the future.
That'd be awesome.
Cool. Be happy to get that for you.
Okay.
Another option that we could actually have you do as well is maybe come in a little bit more frequently. That can help us kind of catch any problems before they start, but it also allows us to just have more time to chat, kind of figure out, you know, how you're doing, what's going well for you, what's not, work with you, help troubleshoot problems. We can also do a few things when you're here in the office, like put fluoride on your teeth more. I know you've had that in the past, but we can do that up to 4 times a year maybe now, and that could make your teeth as strong as possible. We even have you know, a few other options that we could talk about depending on how that goes and, you know, how using the rinse goes and whatnot. So there are things that we can do, I guess, to help you out. So tell me your thoughts on that.
So I come in twice a year right now. Are you saying come in maybe 4 times a year instead?
Yeah, maybe like once every 3 months instead of once every 6.
Yeah, I could definitely do that.
Okay.
That's fine.
Cool. So you'd be willing to come back a couple more times a year. We can kind of see where you're at, and then maybe go from there. Like I said, you've had really great hygiene in the past, haven't had a lot of cavities, and it sounds like, you know, avoiding that is important to you. So we're happy to help you with that. Happy to help do what we can to partner with you to, you know, help you keep your teeth healthy for as long as possible.
So we'll kind of get into some of the specifics in terms of what's happening in some of those conversations, and hopefully you guys can walk away from here with then an idea of, okay, so what are 1 or 2 or 3 things that I could actually do that we saw in that video that might actually help you in terms of talking with patients in a way that engages them and allows them to make the behavior changes that they want to make. Sound good? Okay. So let's look at the 3 different strategies then. So I have, like I said, I have 3 different ways that I think are relatively low-hanging fruit that aren't huge changes to your normal flows, the things that you might do with patients that are good places to start. So we've been teaching this for a lot of years to a lot of people, and these are some of the things that we have found to be most effective and easiest for people to implement. So I have 3 different things then to show you. So one is the idea of sharing information. So we have to share some information with patients. We know that. How do we do that in an engaging way that actually helps people process the information well? I'll give you a framework for how to do that really well. We'll talk a little bit about open-ended questions, and specifically one spot where I think that open-ended questions land really well in terms of talking with people. And then lastly, we'll talk a little bit about goal setting and what that really looks like for patients. So how do we help patients set goals that they can achieve, but they are actually the ones who are setting them and why that might be important. So those will be the 3 kind of big buckets that we'll look at today, and there will be some individual skills that you'll see in each of those areas that will hopefully be helpful for you. So this health information technology guy named Leonard Kish a few years ago said this: patient engagement is the blockbuster drug of the century. It's not a drug, but you get the gist, right? And then Health Affairs, which is this really big kind of nationally recognized, where's healthcare going, what's happening, kind of took it and run with it. They did a whole issue on what does that mean? What does patient engagement mean? How do we do it? What are the specific parts of, you know, that we can actually implement and whatnot? So this is engagement is a really, really big deal in terms of helping patients become healthy. And so not only getting good outcomes, but reducing costs of the overall system and doing all these really important things that we know in terms of healthcare. So then my question is, okay, great. So patient engagement, blockbuster drug of the century. What promotes engagement? What can I do that promotes engagement? And we talked about some things last May that I think we can, and I'm happy to review those as well afterwards. But I think one of the best ways to answer this question is to look at the converse of the question, right? So what promotes disengagement? And I think we all know inherently one of the things that is the most disengaging in an office is hearing something that you already know. Getting lectured on something that you already know. There's a study that came out in Journal of the American Medical Association, JAMA, in 2018, found that 80% of people, 60 to 80% of people, did not tell the whole truth to their physicians. So essentially lied to their physicians when asked about various parts of their health. The number one reason, so most people are doing it, the number one reason most people did it was because they didn't want to feel shamed and they didn't want to be lectured to. Okay, so that makes me then say, oh man, but I got all this good information. I got all this good stuff that I can actually teach my patient. That's important for their health. So then the question becomes, if just telling them something they already know or giving them a lecture on what they should do is disengaging, how can I do that in a really good way? So I'm going to give you guys a framework here that I like to call explore, offer, explore. If you look at the motivational interviewing literature about this, it's called elicit, provide, elicit, which feels very jargony to me. Jargon is also disengaging. So I like explore, offer, explore. It feels a little bit more open. And what this allows us to do is to share the information in a way that allows the patient to have a voice in what we say. So the first thing that we want to do is we want to find out what the person actually knows about what we want to share the information about. So if we want to talk to them about silver-diamine fluoride because we think that that's something that might be important for them or for their child, the way I might start that conversation is, hey, we have this stuff that stops cavities. I wonder what you know about, it's called silver-diamine fluoride. I wonder what you might know about that. Oh, nothing, I've never heard about it. Versus somebody who might say, oh, well, my other kid had that, so they didn't have to go to the hospital. That's the stuff that turns your teeth black, right? Yeah, okay, cool. So we're gonna have a different conversation with patient number one than we are with patient number two because of what that person knows at the outset, right? So we have to ask that question, what do you know? So that's the first explore. Then we want to share some information with them, and again, we want to do this in a way that is not disengaging, so we're going to share bite-sized pieces of information. This is not like 45-minute monologue, stand on my soapbox time. This is a time to share something in non-jargony language that allows the patient to engage with what you're trying to talk about. So silver-diamine fluoride is this stuff that you put on your teeth, and it stops cavities. Great. That's a small bite-sized piece. You might want to share a little bit more than that. That'd be fine too. We can talk about all the parts of the conversation, but essentially share that information. And then lastly, the most important thing here is to re-invite the patient back into the conversation by finding out what they think about what we shared. So tell me what your thoughts are about that. If you remember just from a few minutes ago in that video when we were talking with Craig, gave him some information on how that can affect his teeth or some of the options that we potentially have. Tell me what your thoughts are on that. That's his chance to say, oh, okay, so here's what I'm hearing from you, and this is what I think based on what I might be able to do or not do. If we don't do that, the conversation tends to kind of go off of a cliff right there. It tends to crash and burn. You remember the old road runner, right? He would run out and he would keep going and the coyote would just kind of fall down. And that's what happens if we don't invite the patient back into the conversation. We're running off with our good information and the patient's following behind, and then all of a sudden just falls off the cliff because they're not involved in the conversation anymore. They don't know what to say. What do you want me to say after you've given me everything you know about silver-diamine fluoride? So re-inviting the patient back into the conversation with that. So tell me what you think is a very, very, very important part of this framework. So explore, what do you know? Offer, share with them something. Explore, what do they think about what you shared? Really a good way to take what we know and the many things that might be able to help a patient, something that we do every day, right? Something that we're going to share information with someone, probably every patient, most patients, most parts of the day, and turn it into something that's a little bit more engaging and allows the patient to be a part of that conversation. How does that feel to everyone? See, we just did it there, right? Okay, explore, offer, explore. So what does this look like? So here's another quick video. See if you can pick out the pieces here. See if you can pick out the pieces because it's not always exactly the same. It's not, so tell me what you know about this. Oh, now can I share some information with you? Tell me what you think. It's not always those exact words, right? You're gonna have to find your own words for this. But I'm gonna show you about a minute clip or a minute and a half clip here where explore, offer, explore definitely happens, and see if you can pick out the pieces where you're like, oh, there was the explore, oh, there's the offer, oh, there's the explore, okay?
All right, Stephanie. So I wonder if we can maybe spend a couple minutes just chatting through what I saw when I was taking a look in your mouth. something that I saw in the chart as well, maybe that you put in there, but it looks like your mouth is pretty dried. When you were in 6 months ago, I hadn't noticed that. Maybe can you tell me a little bit about how do you notice that? I wonder if something has changed for you.
Yeah, my mouth has been more dry. I've noticed I've been taking more medications as well and started noticing it then.
Okay. So you kind of have noticed it, and it's been something at least that you've been aware of, and
Yes.
think it might be maybe due to maybe medications, you've taken some new ones.
Yes.
Okay. So I wonder if I could talk about a little bit about how that impacts you dentally, and then maybe some of the options that we might have to help you change that.
Yeah, that would be great.
Cool. So dry mouth is one of the things that puts you most at risk for getting new cavities. And not only that, the cavities that tend to appear can go really fast. Saliva is a huge protectant of your mouth. And so this can put you not only at high risk for getting new cavities, but even extreme risk. And so that's, not great, but there are some things that we can do that really can help you avoid new cavities. I wonder, kind of hearing that information, how does that jive with you? How does that make you feel? What are your thoughts on that?
Yeah, my smile is really important to me, so I'd love to hear what you could recommend.
Okay. So do you want to keep your teeth as healthy as possible despite this kind of new situation?
Absolutely.
Okay, cool.
So hopefully you could see the explore piece of that. We could see the offer. One of the things that I tend to do that I think can be important is to ask permission when I'm offering. Would it be okay if I shared some information with you instead of just saying, I'm going to share some information with you now? Again, it tends to give the patient more of a voice. I've never had someone say, no, I don't want that information. But even just the simple offer to say, hey, would it be okay? I do that with a lot of different parts of my appointments, which I think is really important. So like, for example, a lot of times we assume that someone's at the dentist. So, hey, you got to get in here, shut up, open your mouth. Like I'm going to, put my hands in your mouth, right? I'm going to feel weird, vulnerable parts of your body. And so, for example, when I'm doing like a head and neck exam, I'll always ask like, hey, is it okay if I feel outside of your mouth here? I just want to feel some of your muscles and glands, see how all that feels and whatnot. Most people are like, yeah, that sounds great. But I have had people, due to cultural reasons or whatnot, that are like, nope, that's not okay. Great, cool, that's good for me to know, and now you feel more comfortable. You don't feel like I'm violating your personal safe space, et cetera, right? So that simple piece of asking for permission as well can be really valuable, especially in something like this when we're offering information to someone. So would it be okay if I shared some information with you? And then we re-invite the patient back into that conversation. I find this to be really effective, especially when we're talking about treatment options. So for example, we know sealants are really effective at preventing cavities. And so we'll talk with a lot of patients about, hey, so tell me what you know about sealants. Oh, I've never heard of that before. Okay, would it be okay if I shared a little bit? Yeah, so we share some information with the parents. What do you think about that? Oh man, I really want to get sealants for my kids. That sounds great. Yeah, I definitely want that, right? So that re-invitation is now the patient saying, yes, I want to do the thing that is going to keep my teeth healthy. That's what we want them saying. Right? We don't want to try to have to pressure someone or make someone feel like we're forcing sealants on their child. I would much rather have a parent say, yeah, can my kid please have sealants? Yeah, can my kid please have fluoride varnish? Right? Instead of us feeling like it's something that we have to push on people. So inviting them back in the conversation can be a really effective way of doing that. Okay. So if sharing information with people in a effective way, in this kind of explore, offer, explore way, can promote engagement. And we know that one of the things people don't want is to be lectured to or told things they already know. So what other skills can actually help us turn a lecture into a conversation? I would encourage you all to go out next time you have coffee with your friend. Just go out with your friend and start down and just start like telling them what to do. See how that goes for you. See how that coffee date feels for you. It's probably not going to feel too good, right? We all want to have conversations with people. So what are the things that we do as part of our normal everyday conversations? Because you all have friends, right? You all go on coffee dates with people, or you all go out to a beer with somebody, and you are able to have a good conversation. What are the things that you are doing that are enabling that conversation to go well? I want to offer you guys two things specifically as it relates to healthcare that I think can be really effective, and we saw them earlier. The first one is simply asking open-ended questions. If you want to have a conversation with someone, if you want to hear from someone, asking them an open-ended question instead of a closed-ended question can be a really good place to start. And then secondly, helping patients choose their own goals. So instead of me saying, you need to do this, you should do this, it would be good for you if you did this, right? What I would love, and what is better, we know from evidence that people are more likely to follow through on something when they're the ones who decide to do it, right? Which is why no one ends up having somebody else set your New Year's resolutions for you. You don't like go to your best friend and be like, give me 5 New Year's resolutions. I'm gonna just do those things, right? No, we all like, okay, what do I wanna do? We know that people are more effective when they do that. So how do we help people be the one to say, wow, you know what? I actually know that I should brush my teeth more. My toothbrush sits in a drawer. If I put it on the counter, that might be helpful for me. Great. I want that patient saying that instead of me saying, your toothbrush is sitting in your drawer, you should take it out and put it on top of your sink, right? So how do I actually do that? And hopefully we'll give you guys a couple little skills that'll help you move towards that way, okay? So first off, open-ended questions. We have a space in dentistry where this is going to be really, really, really easy to implement because pretty much with every patient, we do what is called a caries risk assessment, right? And a caries risk assessment, if you go ahead and, you can pull it up, any of them, the Canberra one, you can pull up the ADA one, you can pull up the AAPD one. All of them are a series of closed-ended questions, generally about 13. And we know that this is just an extremely disengaging process. Do you do this? Do you do that? Do you do that? It feels like a test, right? So either what people are gonna do is just kind of stop paying attention, or they're gonna give you the right answers generally. Except they feel like they're being graded, no one wants to fail. And so what can we do to turn an assessment into a conversation? So here's what I tell people. There are a lot of ways to do this. I would encourage you to go out and try. But what I have found is that most of the caries risk assessment questions fall into several categories. And so what I've done is looked at the questions and said, okay, if I were going to put this in part of a category and then ask an open-ended question about that, what would that look like? So I often say to people, I think you can do the caries risk assessment in 3, 4 open-ended questions that are going to allow you to hear much more from the patient than if you're simply asking 13 closed-ended questions. You're going to get more from a patient when you ask these types of questions as well. So if you were only going to ask those 4 questions, what would they be? Because if you're like me, you're like, okay, I want something that I can go try. And this might not work perfectly for you, but this might be a place for you to start. So if I were going to ask 4 questions, it would probably be these. Tell me what you do at home to keep your teeth healthy. Fluoride is one of those things that some people know, some people don't, so I kind of preface it a little bit with, hey, we know fluoride really helps keep your teeth healthy, one of the most effective things that we have in dentistry to help keep your teeth healthy. I wonder, some people have it in toothpaste, some people have it in their tap water. I wonder if you know any places where you might be getting fluoride. Cool. Now they can start telling me about those things, right? Tell me what you eat and drink during a normal day. So what does your normal diet look like? What do you like to eat and drink? And then lastly, what's been your experience at the dentist? Just kind of share a little bit with me. And what we find when we ask these types of questions is if you just sat down and had that conversation and then went back to your caries risk assessment later and checked off the boxes, you would probably be able to check almost every single box that's on there. That's not like a very clinical thing, right? So to me, the caries risk assessment is 1 part caries risk conversation, 1 part caries risk examination. Right? You're gonna have to look in the mouth and be like, oh, do you have a whole bunch of cavities or do you have plaque or whatever? That part is, you can't have a conversation about. Sometimes you can, as we'll see maybe in just a minute. But if you do these 4 things, you probably can check off most of the boxes that you need to. I would also encourage you in terms of engaging things to not have this conversation sitting there looking at a clipboard with all of the questions on it. I would probably also encourage you to take your computer and to push it away from you. There was a study that also came out in JAMA last year that showed that physicians who did not use a computer during the initial interview were found to be viewed as more competent, more professional, and more compassionate, better communicators than people who sat there and looked at a computer the whole time. And I don't know about you, but if you've ever been in an office where someone's just sitting there like taking notes, I'm like I feel like I have to like peep over their shoulder a little bit, like somehow it's like my health information, but like I'm like spying on them, like typing in, to the health record. I'm like, no, I just want to talk to you. Like have a conversation with me. Can you type that later? Can you get a scribe? There's lots of different options. So these 4 questions, I think, again, can be helpful. They might not be perfect for you. You might have to go back and ask some follow-up closed-ended questions, and that's fine. But this is just a way for us to kind of reimagine a caries risk assessment and say, what's more important here is not every single yes or no, but it's really the idea of us engaging over this process. So what does that actually look like? Again, another short video here to show an example of specifically the last question here to show what that might look like for you.
And yeah, the last question I have is just, I'd love to kind of hear a little bit about what it's been like for you at the dentist. What's been your experience with the dentist? When have you tended to go? Some of that stuff. Can you just tell me a little bit about your dental experience?
Well, the dentists usually ask me how I'm they usually ask me how occasionally are you brushing, are you flossing, stuff, and they once every few times they do an X-ray on my teeth, so to see if I have any baby teeth left or anything like that.
Yeah. Gotcha. So it sounds like you've been pretty consistently. You remember some of the things that have been happening at the appointments. Yeah, I wonder, have you ever had any cavities?
I think so. My dentist told me I had one 1 or 2 years ago.
Okay.
Something like that.
A little while ago. Okay. Great.
So you can see in there, tell me what it's been like for you at the dentist, right? And I can find out, hey, this person has a dental home. She's been going consistently. She knows what happens. If you don't have a dental home, you're not going to know what happens at the dentist, right? So I'm finding out some things. I find out, okay, then I ask a little follow-up question. Hey, have you had any cavities? Maybe a couple years ago. Okay, I'm starting to get a pretty good sense of what this person's risk might be simply by asking them one open-ended question. We did some other things in there, and we can get a lot deeper into a lot of these skills in terms of reflective listening and whatnot. But even if you don't take any of that away, simply just the ability to say, hey, tell me what it's been like at the dentist for you, instead of, do you have a dental home, can be a very different type of question for a patient. So hopefully that's helpful as you guys think through actually doing this in your office and really kind of changing that experience from a assessment, a grading, hey, we're focused on grading you here, to, hey, let's have a conversation. Let's talk about this. All right. So lastly, I want to focus on this idea of helping patients set their own goals. So self-management goal, pretty common language in kind of, especially in primary care and whatnot, because so many ways that we manage chronic diseases are based on what the patient does at home. And I think the important point to note here is that it's a self-management goal, not a provider-driven, provider-given, provider-handed to you on a silver platter goal, right? We want people to be the ones actively involved in choosing their goals, because we know that, again, they're more effective if they do that. So self-management goals then are by definition patient-driven. But I would also say that based on having those good caries risk conversations, what I often hear from people, so tell me a little bit about how you take care of your teeth at home. What we tend to hear from people is, yeah, I've been brushing my teeth twice a day. I think I got prescribed this prescription toothpaste. I don't use it. I probably should. Right? Oh, okay. Right? You just told me something you knew that was good for you that you're not doing, right? That sounds like a self-management goal. When we have good caries risk conversations, oftentimes patients will start telling you the things that they know that they want to or should do to keep their own teeth healthy. And that's much better than me telling them what they should do to keep their teeth healthy, because we know that they're more likely to do it. So these are linked, I would say. A good caries risk conversation will help patients set better self-management goals. Simply talking about patients' overall goals for their teeth. We saw in the first video with Craig where, if you noticed me saying, I remember you saying you don't want to come in, you don't want to have shots, right? You want to keep your teeth healthy because you just don't like the dentist, right? So if I can link that back to, so what do you think you can do right now to help you actually achieve those goals, right? Those are the kinds of questions we want to be asking to help the patients actually set their own goals. And lastly, we want it to be something, this acronym SMART, so specific, and time-oriented and actionable, and all of the good definitions there in SMART for that acronym, in terms of it has to be something that's measurable, blah, blah, blah. It doesn't have to be all of those, but if someone's like, I just want to keep my teeth healthy, that's not a self-management goal. That's like a good overarching goal for your teeth, but that's not a specific way that you can actually go about doing that. And so I'm like, oh, that's great. You want to keep your teeth healthy. I wonder if you have any specific things that you think about. And especially with things like when I'm talking like with a teenager, and they're, teenagers are very notorious for saying, I just forget. I just stay up late and I forget, and I know I should brush my teeth, but I forget. And literally every single teenager, without fail, when I ask them, so how do you think you might be able to remember? They're like, well, I'm gonna use my phone. Okay, great. I have some issues with technology use and whatnot, but sure, if you think that's gonna work for you, great. But what I don't wanna do then is start to hear that from every teenager and be like, what works for every other teenager is you should start putting an alarm in your phone because that works for everyone, right? I still wanna ask the question, what do you think is gonna work for you? When might you do it? Oh, so you're gonna put an alarm in your phone. What time do you think might work for you? Right, so I'm the one that's helping them get this specific, measurable, time-bound goal by the kinds of questions I'm asking and not simply just telling them what to do. So if these are good characteristics of a self-management goal, are there ways in which we can actually use tools that we have in the office to help people think about this? And the answer, of course, to that is yes, otherwise I wouldn't be asking the question. And so there are what we call self-management goal menus that help patients know what kinds of behaviors might be helpful for them to choose in order to do that. So here's an example of one. You see at the top, what can I do to prevent cavities? Talks about what are your oral health goals. There are some things we can do in the office. We might have someone say, oh, wow, protect my teeth. Tell me a little bit more about sealants. Yeah, I'm interested in that. I'm an adult. That's fine. Like, I have a couple grooves on my teeth that I probably should get sealed. I would be okay to that, to doing that. There are some things that people can do at home. Fewer snacks, healthy options, more water, right? Oh yeah, I know I've been eating a lot of chips because I love salt, but I know that's probably not the best thing for my teeth, so maybe I could choose something else. Do you have any ideas of what I could choose? Oh, wow, right, now they're asking me, like, what could I do to keep my teeth healthy? That's a good place to be. There are different ways to use this. So you saw in the first video with Craig, we handed it to him in the chair and we used it in the chair. One of the ways I've also seen this be effective is to give it to people when they come in while they're in the reception area, filling out some paperwork or doing whatever, just simply waiting for their appointment, and prefacing it with, hey, we'd love to have a conversation with you about things that you can do at home to keep your teeth healthy. Take a look at this list, take a look at this sheet, see what you might think might be ways for you to actually do that. We'll have a conversation in the back. Great. Now they're proactively thinking about it while they have a little bit of space and time. We also see one of the things that I tend to hear offices feel is that I have to solve everyone's problems all at once. So if it's a new patient and they're coming in, they're doing 15 different things that are bad, like it's now my job to tell them everything that they're doing that's wrong, and I have to fix all 15 of those behaviors before the next visit, or somehow I'm not doing my job. Right? We know that that's not true. We know people can generally accomplish 1 to 2 things at a time. So often I'll include that language as well. Like, when you look at this and you see 1 to 2 things that you might be interested in doing to help keep your teeth healthy, not choose all of them, right? Just 1 to 2 things. But if we're doing this consistently, for example, you can see these for different age groups. So there might be one there is one out there that I've seen that's just specifically for teenagers or for younger kids, like 6 to 18. And there are some things on there like avoid piercings. Well, I don't know too many 6-year-olds that are like, man, I'm getting a piercing on my tongue because that's pretty sick. No, most kids aren't choosing that. But if we're using this consistently, I also wonder the kind of effect that might have on them actually knowing healthy behaviors versus not knowing healthy behaviors. I haven't seen studies out there about this, but if a 6-year-old is coming in and being like, what are some healthy things you can do? Avoid piercings. Somewhere in their brain, they've seen it once, twice, 5 times. They say, oh, well, I kind of know that somewhere in the back of my brain that getting a piercing is not healthy for my teeth. Maybe I shouldn't do that somewhere down the line when they might actually be considering getting a tongue piercing or whatever. So I think that there are multiple ways that this can be effective, and all that to say we don't have to help everyone change all at once. We can have these conversations over time. Our goal is a longitudinal relationship with patients that allows them to achieve oral health throughout the course of their life, not make 15 behavior changes at once. We know that's not effective, right? So self-management goal menus, lots of different ways to use them, and we'll spend some more time on Saturday morning, I think, actually really getting into what does this look like, how do we use these, why have we picked some of these behaviors that are up here in terms of thinking about what that looks like for our patients. So if you were going to go home and do a couple of these activities, so we have sharing information in an effective way, caries risk conversations, asking open-ended questions instead of closed-ended questions, and lastly, helping patients set self-management goals. If you were only going to do one or two of those things, what might be the easiest? In the true spirit of self-management goal, if you were going to leave here and change one thing, what would you change? What I tend to see for people, and again, you can make up, we want you to decide what is most effective for you and where you currently are based on your current number and all that good stuff. But what I tend to see for people is that caries risk conversation, just changing asking closed-ended questions to asking open-ended questions is a pretty easy shift for people to make. It's not that hard, especially because we have something where we can look at those 4 questions and say, great, I can try that once. That's not that hard. So caries risk conversation tends to be a place where we can do that. Sharing information next is something that we do so often that you have a lot of chances to practice. And so that can also be a relatively easier shift for people to make. Setting self-management goals with patients, helping patients, see, falling into that language, right? Setting self-management goals for patients. No, helping patients set self-management goals, it can be a little bit more complicated, especially if you want to use something like a menu because it involves, a sheet that you have to get and, some of those things. So there's a little bit more logistical challenge sometimes in those, and we've often been trained to just tell people what to do for so long that shifting that mentality is a little bit hard. But it can be really effective, and often using that sheet is helpful for us in terms of moving away from our old behaviors towards the behaviors we want to actually embody with our patients. So if it were me, these would be the order in which I would try things. Might be different for you, but I just wanted to give you guys this is what I've seen be effective over the course of time. So before we close, let's go back to this scale. So you all figured out exactly where you were on this baseline on a scale from 0 to 10, where 0 is not confident at all and 10 is super confident and simply talking to your patients about more than just brushing and flossing. Where did you start? So my question for you now is, what can you commit to do when you go back to your office? What can you commit to do when you go back to your place of work to say, this is how I'm going to move myself 1 or 2 numbers up? Maybe it's, oh yeah, I'm going to go find that slide about caries risk conversation and I'm going to try that once. Maybe it's, I'm going to find a self-management goal sheet, which there are many out there. You can simply Google self-management goals dental and you'll find a lot of different options out there. There are plenty. So you might do that and say, great, I'm going to try that with one patient and just see how that goes. Maybe it's going and finding some of those videos to really see what it looks like for us to do, have these kinds of conversations with patients so you can reimagine what that conversation might look like with your patients. But for you, what's the one thing that you're going to do that might help you move 1 or 2 numbers higher? Again, we're not going to share that out loud, but just something for you to kind of put in your brain as you think about going back to your place of work. And I want to close with a quick patient story because we do this for the patients. And I think so often we get caught up in our world of, okay, I'm going to be a better dentist, I'm going to be a better hygienist, I'm going to be a better oral health person, right? And we miss the stories of the patients who are out there trying to support because we're caught up in our own world. It gets busy, right? We're all trying to be the best version of ourselves that we can be. So this is not Sean, but this is the closest image I could find to Sean because I don't have a picture of Sean. But Sean is a good-looking, middle-aged guy that came in to see me not too long ago. And the first I heard of him, my dental assistant came up to me and said, this guy, he's scared. He's really scared. And he's a new patient. And so I'm thinking, okay, he's really scared. He must, have a lot of problems, blah, blah, blah. So I sit down and talk with Sean. And Sean, to kind of spoiler alert, Sean has a perfect mouth. Like literally nothing I can do in his mouth. Sean is so scared to come into the office that day because he feels he hasn't been in 5 to 7 years-ish. And he feels totally, totally ashamed that he's gone that long without coming into the office. And that he literally can't even look me in the eye because he's just so ashamed. And so that came across as fear to my dental assistant. I'm scared to be here because I don't know what the dentist is going to say to me. And we didn't have to have a lot of conversations about behavior change and all of those things. What we had to have a conversation about was what were his goals and how did he, now that he's here and we're not judging him, how does that make him feel? And how does he want to see himself moving forward? What does he think the next 5 to 7 years could look like in terms of his dental care, since the previous 5 to 7 haven't looked like what he wanted? And he left that day feeling so enthused and energized about what dentistry could be for him compared to how he had come in, which was scared, which was truly ashamed. And since then, John has been coming in regularly, and he's totally different, right? He's not a patient that you would classify as scared, right? He just had so much going on inside of him that he needed to hear, hey, we're not gonna judge you. Hey, we're gonna walk alongside you. Hey, we're here to help you, not simply make you feel bad about the fact that you haven't done what you wanted to do. And to me, that's the true power of a lot of this work. We get to hear more patient stories. We get to hear more of what patients want to do, and we actually get to see them achieve those goals. Sure, it feels great when I have a patient that needs a restoration and I go in there and I do the best restoration I've done. That feels good. And I think it oftentimes feels better to me when I have a patient come back and say, you know, I did it. I set this goal for myself and I did it. Because then it's their accomplishment, right? Then it's what they've done, and I'm simply here being a cheerleader, being like, great job, way to go. You are doing it. You are achieving oral health. And ultimately, that's what I would like to see for people, is this experience of the dentist is not what my friend likes to call it, which is this semi-annual scolding. But it's more of his, hey, I go to the dentist and we work together on ways that I can keep my teeth healthy, keep me smiling, keeping me achieving all the things that I want to do in terms of chewing and, you know, doing all the many things that my teeth help me do. So hopefully these 3 skills, sharing information well, using Explore, Offer, Explore, asking open-ended questions, and lastly, helping patients set their own goals, are helpful ways in which you can achieve that goal of truly supporting patients in achieving their own goals. So thank you guys all very much. I really appreciate you listening to me.